Welcome back. This is video number 2 on pruritus. Let's scratch the itch of understanding and go deeper into our patient assessment. First, start by asking these questions. When did it start? Can they really pinpoint it? Is it chronic, like over months and years, or did it really just get noticed within the last weeks or even a few days? How often is it experienced? Is it only at night? How long does it last? Is there anything that makes it worse? And of course, is there anything that makes it better? Look at the patient. You have to get their clothes off and really look at the skin. Do you find scratch marks on the skin, or perhaps there might be a rash? So let's say there are scratch marks or a rash in a specific area, or is it generalized all over the body? Are there any signs of infection? You've got to review the latest medications. Have there been any additions or changes? What about changes in foods? Often our patients, our hospice patients, are transferred or moved to a facility to receive a higher level of care. That means changes in diets, everything, even in changes in the products that are used to wash linens and clothing. Make the adjustments that you can to each of these problem areas that you might have uncovered just as best you can. For instance, in laundering clothing, perhaps ask the family to take the clothes home and use the previous laundry detergent and see if that makes a difference. If it does, great. The family may need to be continued to do the laundry. Generally, a facility is not going to change all of their laundry products for one patient. Okay, let's say you've completed the assessment. Where do we start with treatment? Often a topical treatment is recommended, especially if the problem area is in a particular place in the body that's easy to coat. Often a first try is a thin layer of 1% hydrocortisone cream to the affected area. It's put on 3 to 4 times a day for maybe a week. If a rash appears to be fungal in nature, then an antifungal cream or powder can be tried. These types of rashes are generally found in warm, moist folds of skin, such as the groin, under the breasts, or the belly apron. The topicals are especially effective if the itch is located in a defined area. What if it isn't? I'd like to share with you a recent case of mine. I had a patient who was admitted to hospice care for dementia, yet her entire body was just bright red, almost magenta, with inflammation and itching. She looked like she'd been scalded. The itch was absolutely driving her crazy and was really contributing to her dementia decline. She was unable to sleep, she couldn't eat, she was really going downhill. Topical creams, even oral steroids weren't helpful. I happened to suggest that we just try an antifungal in one area, and we did try some nystatin cream in the groin area, and it actually got better. And so what we did was the doctor helped me talk about this, and we prescribed diflucan. It was 200 milligrams daily, and we used it for a couple of days, got so much better that then we continued it for almost 3 weeks. The relief was so amazing. She was able to sleep. She began to eat again. She increased her fluid intake. Everything improved once the itch was controlled, even her mentation. And then she was allowed to die maybe 6 weeks later, but it was the dementia that caused her death, not that horrible itching. So as in all cases, you've got to get a good assessment. Sometimes it's trial and error to find out what works. We're all guinea pigs, and to do a good assessment, we'd use educated trial and error. Thank you for listening, and in the final video, we will be talking about itch related to specific diseases, renal and liver. So come back for the final to get some more information on specific oral medications for problems we run across. And don't forget to get our booklet. You can get it at our website, the Hospice Care Plan. Go to our YouTube site, the Hospice Care Plan. We've got lots of videos for you. Send in questions, comments, read our blog. We want to be included in your needs so that we can meet them. And remember our Odonata motto, the Hospice Care Plan: care is the treatment.